say? I'm the ER nurse. What seems to be the problem today?
I have a numbness in my left hand and I feel like heartburn.
And how long ago have these symptoms started?
About like 2 hours ago.
About 2 hours?
Yeah.
Okay, we're gonna do some assessments. I'm gonna write this all down and the physician will be in soon to see you.
Good morning, my name is Nahed. I'll be your nurse for today. How are you feeling?
Not very well.
What are your symptoms?
I have heartburn and my shoulder has numbness and I cannot breathe well.
How long have you been feeling that way?
About a few hours now.
I'm gonna be checking your vital signs. Nurse will come in here and get you started with some IVs. Okay. Could you please verify your name and date of birth for me?
Fana Z and April 21st, 1979.
Okay. Take your temperature. So your temperature is 98. Taking your blood pressure. What is your pain level right now?
9.
9. Okay. I'll talk to the doctor and make sure if we can send you out this Tylenol or something, okay?
Thank
Alright, see you soon.
All right, room 1.
Alright. We have 45 years old Hispanic female presented to the AD with the symptoms of increasing shortness of breath, fatigue, and heartburn for the past 2 days. She also have numbness in the shoulder, and this is her first time in the AD for these symptoms. I took her vital signs. Her vital signs is 150 over 95, and her pain level is 9 out of 10. Her oxygen is 92.
Any significant medical history?
No medical history and no current medication.
Have you drawn blood yet?
Not yet.
No. How about EKG?
No. Nothing started, just vital signs.
Okay, so we'll get started on that. We're gonna grab an EKG, get blood work, and then hopefully, if it comes to it, we'll call down to cath lab.
Okay, sounds good.
Ready? Hello there. So
Hi.
I've heard a few things from your nurse. Can you tell me what's going on today?
I have my heartburn and I have numbness in my hand and I feel so tired. I have really bad pain in my heart.
So
I can breathe well.
can you breathe well now? Okay. All right. Well, we'll just do a quick little assessment just to make sure that everything is okay, or if everything isn't okay, that we can get you started on what we need to do. When did this heartburn begin?
A few hours ago.
A few hours ago? Okay. Is this the first time it's happened?
Yes.
Yeah? Okay. Okay. You said you're having no difficulty breathing.
I had before, but after I'm using this, it gets a little better.
Okay. Well, I would suggest we keep that on, but if it's uncomfortable, we'll go grab a nasal cannula for you just to keep your oxygen levels up, okay?
Thank you.
Have they drawn any blood?
Yes.
Yes? Okay. All right, I'm just gonna perform a quick assessment, okay?
Sure.
Actually, boom. I'll sit right here. I'm gonna have you look straight ahead. Close your eyes. Open. Boom. Close your eyes. And open. Boop. Okay, open your mouth. Boom. Okay, good. I'm gonna listen to your breath sounds, okay? Okay. 1, you turn your head that way for me, real quick. Okay. Any stomach pain?
No, just the heartburn.
So it's possible that you're having what we call acute coronary syndrome, or you're showing signs of acute coronary syndrome, which means that there might be something blocking this little vessel in your heart. And so your heart isn't getting any oxygen or nutrients, so it's not able to pump, and some of those cells actually might be dying off. So we're going to observe the EKG, look at your labs, and go from there. It is possible that you may need surgery, but we will make that decision pending results. Okay?
Gracias.
De nada.
They said your blood pressure was really high.
Yeah, it was.
Okay. I know the hospital food was like really salty.
Did you bring me something?
Yeah, I brought you some snacks. I brought you some.
Can I eat? Like, did you bring me taco? I really craving taco.
We can get some after. Let's see what the doctor says first, though, because I know your blood pressure is really high, and I don't want to get it even higher. You know?
Hello. And hello. Who do we have here?
My husband.
Oh, pleasure. What's your name?
Mr. Z.
Ah, Mr. Z. It's a pleasure. It's a pleasure. Glad you're here, because it looks like we have the results. And I'm here to tell you that you won't be needing surgery today, but it's possible that sometime down the line you will. But we do have a list of medications for you to be taking home, and we'd like you to take these on a regular / as needed basis, depending on how you're feeling. Okay? So let's see, what do we have? Aspirin, clopidogrel, and prasugrel. Not all of them. These are just options. They are antiplatelet drugs. They pretty much prevent what happened today from happening again. Essentially, little things called platelets, they'll start to bunch together, and they can just block off that vessel. Okay. And that's what these drugs will prevent. We have nitroglycerin. Nitro is a vasodilator. It'll open up those arteries, those coronary arteries if needed, to allow blood flow in. And metoprolol controls how hard or how strong the heart will be. Okay. Let's see. We'd like you to follow up with your cardiologist, and if you ever experience anything like you did recently, please don't be afraid to call 911. Do you have any questions?
I have a couple questions, doctor. So, these medications, do you want her to take it with food, without food? What would be the best way for that?
We will provide you with all that information in the what we call the drug information package from the pharmacy.
Can I eat everything? Like, I have a restriction.
We'd like you to stick to a low sodium diet, because that sodium, what the body does is take in that sodium, and what follows is water. So boom, you get more water, your system will be overloaded, and there's a possibility for that water to.
But my husband brought me something. I don't know if I can eat that one
I
or
brought her some
hospital
snacks. I
food.
brought her some healthy snacks, but I wanted to make
Healthy
sure
snacks.
that everything was okay first before before I gave her something. So.
Okay. We'll hold on that.
Okay.
Because we also would like to keep you here for about 24 hours under surveillance, just to keep an eye on your heart. Okay, if that's for your safety. I just wanted to give you a heads up.
Okay. Well, luckily, it's Friday, so we don't really have any. The kids don't have school tomorrow, so that shouldn't be a problem. But is it okay? Like, what are the visiting hours? Is it okay if I come tomorrow? we'll have to pick up the kids. So, you know, but I can come back tomorrow morning if that's okay.
That is okay. Just make sure to check in at the front desk,
Okay.
and they'll give you a badge.
Okay.
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 Sounds good.
Sounds good.
Sounds good. Thank you, doctor. Appreciate
Thank you,
it.
doctor.
Thank you.
All right, you got to take care. I'll be out here doing my thing. Let us know if you need anything. All right. Press this little red button if you need us. Okay.
Thank you.
You're very welcome. Just put that right there.
Thank you, doctor. Appreciate it.
Hi, I'm back again. So you've been here for 24 hours, and I'm gonna get you ready for discharge. I'm just gonna take out your IVs. And I'm gonna tape it up.
Thank you.
Okay. Do you have any questions for me?
No, I think the doctor addressed most of our concerns yesterday.
That's perfect. So the case manager will be in here soon to answer any other questions you may have and give you like your discharge plan.
Okay.
Thank you.
Thank you.
Thank you so much.
Hello, my name is Nahed. I'll be the case manager. So, Dr. Myron, we have consulted with the cardiology and attempted to reach her primary care provider. Based on our assessment, the nature of her symptoms necessitates immediate cardiac evaluation and comprehensive long-term management plan. We recommend that the patient to be discharged and referred to an outpatient cardiac with PCP. Okay, and we'll make sure to set up a follow-up appointment with your cardiologist and your primary care provider. This will help us keep track of how you're doing and adjust your treatment if needed. I'll be in touch with all your healthcare provider and ensure everyone knows your treatment plan, and we're all working together for your best outcomes. We'll go over each of medication, what they are for and how to take them, and what are the side effects that you might experience. I'll provide written instructions in Spanish and make things a little bit more clear. Since you prefer Spanish, all your educational material and discharge instruction will be provided in Spanish. If you need help understanding anything, I can arrange for bilingual interpreter or case manager to assist you. I just want to ask you, how's your diet?
Not really good.
Does she exercise regularly?
She's usually really tired when she comes home from the warehouse. So it's like, and the food there is not very healthy either. So it's kind of hard to find time to exercise.
I see. So I'll connect you with a dietitian who can help you with heart-healthy diet. We'll also discuss ways to get you more physical activity, and I can recommend some local program that might work for you. Do you smoke at all?
No, sometimes like once a month, hookah.
So if you smoke, I can provide resources and support to help you quit, including counseling and product to assist you. And for the stress, managing stress is very important. So also just some techniques and support groups that can help you reduce stress and feel a little better. Also, I'll make sure you understand how you take your medications correctly. If you are worried about the cost of any medication, please let me know, and I can help you find a system program. Alright?
Is it expensive?
I think your insurance will cover most of that.
Oh,
Yeah, but if it doesn't, please let us know. We have some program to assist you to cover all of your medications.
okay.
And also, I talked to your cardiologist, and they will contact you to schedule an appointment. You guys have any question for me?
If there's any like weird side effects from the medication, is there a phone number we can call?
You can always call 911 if there is anything urgent. You can bring her here back, but I listed all the side effects she might experience. These are very normal side effects.
Okay.
If anything outside of what I listed, then you can definitely bring her back.
Okay.
Thank you.
I hope you feel better, okay?
Thank you so much.
You are very welcome.
Really